As we grow older, many of us begin taking medications to manage chronic health conditions such as high blood pressure, diabetes, arthritis, allergies, insomnia, anxiety, depression, or digestive problems. Modern medications have helped millions of people live longer, healthier lives by preventing heart attacks, strokes, infections, and many other serious illnesses. However, like all treatments, medications can also have side effects. One concern that often worries older adults is whether certain medications can affect memory, concentration, or thinking. With dementia becoming more common as people age, it's understandable that many seniors wonder if the medicines they take every day could contribute to cognitive problems. Today we will talk about 9 popular medications that can trigger rapid dementia. So, before we start, make sure to hit the like button and subscribe to my channel. Understanding the difference between temporary confusion and dementia. Before discussing medications, it's important to understand the difference between temporary cognitive side effects and dementia. Temporary confusion may develop because of medication side effects, infections, dehydration, poor sleep, hospitalization, or electrolyte imbalances. These problems often improve after the underlying cause is treated. Dementia, on the other hand, is a long-term condition involving progressive decline in memory, reasoning, language, and daily functioning. Medication side effects alone do not necessarily mean someone has dementia. Medication category #1, anticholinergic medications. Anticholinergic medications block a chemical messenger called acetylcholine. Acetylcholine plays an important role in memory, learning, and attention. Many medications have anticholinergic effects, including some used for allergies, overactive bladder, motion sickness, certain antidepressants, and some medications for dizziness. Older adults are often more sensitive to these effects. Possible symptoms include confusion, memory difficulties, blurred vision, dry mouth, and constipation. Current research suggests that long-term use of medications with strong anticholinergic properties may be associated with a higher risk of cognitive decline in some people, although the relationship remains complex. Medication category #2, sleeping pills. Prescription sleeping medications can be helpful for short-term insomnia in selected patients. However, they may also cause daytime drowsiness, confusion, memory problems, poor balance, and falls. Older adults often metabolize these medications more slowly. Healthcare providers usually recommend using the lowest effective dose for the shortest appropriate duration while emphasizing good sleep habits. Medication category #3, anti-anxiety medications. Medications such as benzodiazepines are sometimes prescribed for anxiety, panic attacks, muscle spasms, or seizures. These medications may cause sleepiness, slower thinking, memory difficulties, poor coordination, and increased fall risk. Long-term use has been associated with cognitive impairment in some studies, but whether these medications directly increase dementia risk remains uncertain. Doctors generally recommend careful monitoring and avoiding long-term use whenever possible. Medication category #4, strong opioid pain medications. Prescription opioid medications play an important role in treating severe pain. However, they may also produce sedation, confusion, reduced attention, slower reaction time, and hallucinations in some individuals. Older adults may be particularly sensitive. Healthcare providers carefully balance pain relief with potential side effects. Medication category #5, certain antidepressants. Most antidepressants are effective and safe when appropriately prescribed. However, some older antidepressants have stronger anticholinergic effects than newer medications. These may contribute to memory problems, dry mouth, constipation, and drowsiness. Newer antidepressants often have fewer cognitive side effects, although treatment should always be individualized. Medication category #6, Some medications for overactive bladder, several medications used to treat urinary urgency and overactive bladder work by blocking acetylcholine. As discussed earlier, acetylcholine supports normal memory function. Possible side effects include confusion, dry mouth, constipation, and blurred vision. Newer treatment options may have fewer effects on the brain for some patients. Discuss alternatives with your healthcare provider if concerns arise. Medication category #7 first-generation antihistamines. Older allergy medications may cause significant drowsiness and confusion. Examples include medications commonly used for seasonal allergies, itching, and cold symptoms. These medications often have strong anticholinergic effects. Newer antihistamines generally produce less sedation for many people. Always consult your healthcare provider before switching medications. Medication category #8 certain muscle relaxants. Muscle relaxants are sometimes prescribed for back pain or muscle spasms. Possible side effects include sleepiness, dizziness, confusion, poor coordination, and falls. These medications should be used cautiously in older adults whenever possible. Medication category #9 some anti-seizure medications. Certain anti-seizure medications may occasionally affect attention, concentration, or memory. These medications remain essential for controlling seizures in many patients. Never stop seizure medication without medical supervision. If cognitive side effects occur, your neurologist may recommend dosage adjustments or alternative therapies. Why older adults are more sensitive to medication side effects. Several age-related changes increase medication sensitivity. These include slower kidney function, changes in liver metabolism, reduced muscle mass, higher body fat percentage, multiple medications, and chronic illnesses. Because of these factors, older adults often require lower doses than younger individuals. Polypharmacy, taking many medications at once. Many seniors take 5 or more medications daily. This is known as polypharmacy. The more medications a person takes, the greater the chance of drug interactions, side effects, confusion, falls, and medication errors. Regular medication reviews help reduce unnecessary prescriptions. How to reduce medication-related cognitive problems. Doctors recommend taking medications exactly as prescribed. Avoiding unnecessary medications. Reviewing medications annually. Using one pharmacy when possible. Reporting new confusion promptly. Avoiding alcohol with sedating medications. Staying hydrated. And getting enough sleep. Never stop medications without professional guidance. Lifestyle habits that support brain health. Medication is only one part of cognitive health. Healthy habits include regular physical activity, a balanced diet, adequate sleep, blood pressure control, diabetes management, not smoking, maintaining social connections, keeping the brain mentally active, and managing hearing and vision problems. These habits may reduce overall dementia risk. Warning signs that require medical evaluation. Seek prompt medical attention if someone develops sudden confusion, hallucinations, difficulty speaking, new weakness, severe memory loss, loss of consciousness, or rapid personality changes. These symptoms may represent medical emergencies unrelated to dementia. Common myths about medications and dementia. Many myths circulate online. One myth claims blood pressure medications cause dementia. Current evidence does not support this. In fact, controlling high blood pressure may help protect long-term brain health. Another myth says every medication that causes temporary drowsiness permanently damages the brain. This is also incorrect. Side effects often improve when medications are adjusted appropriately. Questions to ask your healthcare provider. Consider asking whether any of your medications could affect memory. If you still need every medication you're taking, whether safer alternatives are available, if your doses should be adjusted, and how often your medications should be reviewed. These conversations improve medication safety. If you liked this video and would like to see more like it, please give it the thumbs up. Leave a comment and click the button to subscribe.